call was, oh, don't worry, just bring it on. Oh, we'll expand our office hours. We'll see people on Saturday. We'll see people at night. We'll get up at 4 a.m. and do talk radio. And before you know it, you go from this hyper-reactive stage to a stage of emotional and mental exhaustion. And the key really is to recognize this before it happens. And we not only see this in our patients, we need to recognize this in ourselves. Now, everyone responds to changes in the environment differently. And so I like to think about it this way. There's usually some sort of initiating event that occurs in our life. It could be the stock market goes down, whatever it is, whatever your kid could bring home a new boyfriend or girlfriend, and you just think, oh my God, this is a problem. Whatever the initiating event is, the most important part to this is our perception of the event. What does it mean to us? Is our perception that the stock market going down, is it doom and gloom? Or is it, wow, I get to buy something I couldn't afford last week? So it's that perception that leads to the response and the effect on our body. So perception is really everything as we talk about stress and the stress response. Now, we have over 1,400 chemical reactions that occur, and I think at IFM we're capable of putting every one of these out on paper, but that would cause me stress, and I like to simplify things because I always like to look at what impacts my clinical practice and how does it impact my clinical practice. So for the purpose of this talk, we'll discuss the three key ones: adrenaline and noradrenaline, aldosterone, and of course, cortisol. And why are these important? Because every one of these have huge impacts on cardiovascular disease. Now, in the 1990s, I was putting in a lot of stents, and I really was just starting to understand the impact of stress on the physical body. And this diagram really stuck with me because I said, what happens to people when their HPA axis sends a signal that they are under a threat and they start flooding their body with stress hormones? Well, we see enhanced coagulation. We see a shift in the renin and angiotensin system. It revs up. We see weight gain on people, insulin resistance. What a lot of people don't realize is that lipids become abnormal with stress. Almost every one of our patients know that tachycardia and arrhythmia occur when our adrenaline is flowing and our blood pressure goes up. Now, think about this through the language of medicine. For me in the 1990s, I was giving aspirin and Plavix at the time for coagulation. We continue to give ACEs and ARBs to our patients. The impact of cortisol causes weight gain, insulin resistance. We give statins, we give metformin, we give beta blockers for that tachycardia, calcium blockers for that high blood pressure. So every single hormone that gets turned on with stress, we have a drug that we're using to balance that. And quite frankly, for years, we talked about how good beta blockers were for the heart. Well, when you think about that, beta blockers do what? They block adrenaline. So I began to look at this and I said, well, maybe we need to medicate and meditate, right? We're using all these drugs, but maybe we need to look at some other ways to transform the stress response. I won't read every one of these because it's just a lot of words, but it all comes down to the same thing. Stress. We have to think of someone who's in an auto accident, for example, and that person is bleeding. So the body is beautiful in that it puts together a way to stop the individual from bleeding. That means vasoconstriction. Let's constrict these vessels. Let's make the platelets sticky so that they form a clot and the blood can stop. Let's increase the cardiac output by raising the heart rate. So this is, and let's increase aldosterone so it causes salt and water retention to raise the blood pressure. So for someone who's in a medical emergency, like an accident, bleeding, losing volume, this is the beauty of the human body. But unfortunately, we see people living this way literally 24/7. So we see the vasoconstriction and the platelet stickiness, right? We see increases in markers for inflammation, homocysteine, CRP, and fibrinogen, all of which increase cardiovascular risk. We see the impact of cortisol, not only raising blood pressure, not only causing diabetes and insulin resistance, but also depositing abdominal fat around the midline. And then, as you'll see in a few minutes, there are links between stressful events and arrhythmias like atrial fibrillation and even ventricular fibrillation. For the first time in medicine, in cardiology, we have a syndrome called Takotsubo cardiomyopathy, which is affectionately called broken heart syndrome. And this is a syndrome in which the myocardium becomes acutely stunned to the point of causing severe left ventricular function or dysfunction. It looks like someone needs a heart transplant. And usually this is triggered by bad news and an emotionally stressful event. So when we think about the old Framingham risk factors, we say, which of these are impacted by stress? Well, lipids go up under stress. Blood pressure goes up under stress. People have all sorts of maladaptive behaviors to stress, whether it's I have 20 friends in this pack of cigarettes, or I'm going to eat this Cinnabon because it makes me feel good right now. Or the cortisol is going to make me fat, make me diabetic. So every one of these risk factors is impacted by stress hormones. And of course, we know with the turning on of the RAS system, the renin-angiotensin system, we always see a worsening in heart failure. And this is very much described in the literature. And for those of you who may work in the emergency room, ask your patients what they were doing prior to coming in with their episode of congestive heart failure or chest pain. And you're going to hear stories like, I was watching a bad movie, or I was watching a war movie, or I got upset over the football game, or something like that. We'll talk a little bit about heart rate variability, which gets impacted by stress. And of course, stress impacts our ability to resist infections. And we know that people under stress, when they're vaccinated, for example, Lecoq-Glazer's work, they don't even produce antibodies to the vaccine when they're under stress. And of course, as you'll see in a minute, severe stress can cause sudden cardiac death, can cause MI, and so on. So it is a bad player, and it's a bad player that's overlooked. And for many of our patients, stress is what's driving the train. So when we're talking about eat Brussels sprouts and cauliflower and, lots of green leafy vegetables, and someone is under so much stress that they're trying to figure out how am I going to get through the day, they're not hearing any of the other things that we're recommending. So chronic stress and affective disorders, whether it's depression, anxiety, panic, really put our foot on the accelerator and rev up the sympathetic nervous system. We know that the same things we see with aging, as you'll see in a minute, are linked to increased levels of stress hormones, especially cortisol. So whether it's osteoporosis, decreased bone density, endothelial dysfunction, platelet activation, hypertension, central obesity, insulin resistance, this is all coming from a stress response. And we have to have a plan for our patients on how to handle this. The American Institute of Stress says that 75 to 90% of all visits to healthcare providers result from stress-related disorders. And I have to be honest, when I heard the statistic, I said, that's crazy, that's way too high. And so I started to look at my patients and what they were coming in with, and then had them begin to tell me their stories. And what I found, it didn't matter whether it was headaches or muscle tension or angina or arrhythmia or irritable bowel, almost always had some sort of stress trigger. So let's take a look at some areas such as life-changing events. There's a difference between acute and chronic stress, our perception, our social connection, and do we gain some strength from a higher power? And I have to say personally, living through as a physician, living through a COVID pandemic, not only having it affect personal friends, but patients as well, I feel like without my spiritual connection, I might not be handling it as well. So a great study was done many, many years ago. This is the work of Dr. Ray and Holmes, and it's totally worth reading. I think it's just brilliant because 50 years ago, they put together a method for the quantification of life-changing events. How do life-changing events, and how do they rank? Which are the big ones? Which are the little ones? And how does that ranking lead to major medical problems like cancer, heart attack, sudden death in the future? So they looked at 43 life-changing events, and they ranked them originally and re-ranked them in the 1990s. And some of them actually remain the same, and I'll walk you through that in a minute. But they looked at 43 life-changing events, and they gave a adjustment score to the event. And then they looked at numbers that would be linked to major illness. So for example, life-changing event number 100 life-changing units is the death of a spouse. And I think anyone could relate to that. Divorce was number 2, separation number 3, death of a close family member. But also notice that there are some things in there which also got ranked that you might not equate with being a major life-changing event that can impact a stress response, like marriage or retirement. So it wasn't the actual single event that made the difference. It was the adding up of events. And what they found after looking at 67 physicians was if you had a life-changing unit score of somewhere between 0 and 150, not a big deal, no real major illness. But once you hit that 300 mark, there was a 50% chance of major illness. So this is why I always do a timeline on events in my patient's life. I want to know what was going on in their life when their symptoms started, and then I bring it back earlier to really understand what was the environment that this individual was living in. So here's a classic. This is sudden death in people with no history of coronary heart disease. So they were studied for 12 years in this section. And you can see no big life-changing units. People are just puttering along. And then as the life-changing units begin to increase, we start to see the unwanted outcome of sudden death. It's that everything's going okay, and then I go through a divorce and I lose my finances and I have to move, or I lost my job, or some other horrific thing has happened. This is people with a prior history of coronary disease. Again, puttering along and then life-changing events that lead to sudden death. So I invite everyone, when you have that quiet time in that sacred space of your exam room, hopefully, or now your Zoom room, that you can really talk to people about what's going on in their life. And I've seen this ring through, even for cancer coming out of remission. I can remember one patient in particular, when the stock market dropped in 2008, he's the one who said to me, Dr. G, my cancer was in remission for 10 years, and now it's back because I made myself sick over how much money I lost. So the patients sometimes pick this up themselves. In California here, we had a Northridge earthquake, and a study was published in New England Journal of Medicine that looked at cardiovascular events. And what they found, there was a 5-fold increase in cardiovascular related sudden deaths on the day of the Northridge earthquake. And I know everybody's sitting there saying, yeah, that makes sense. Now, when I was at Cornell, I would work the emergency room at night, but I didn't know why I refused to work on Monday nights. I knew Monday nights was a problem because the emergency room was filled with people, heart failure, chest pain. So I said, I'll work any night but Monday night. I didn't realize the connection was Monday Night Football. And then I saw this study. There was a 25% increase in myocardial infarction admissions in London on the day of the match when England lost to Argentina in a penalty shootout during the 1988 World Cup. So imagine, I know when I watch my brother watching a Super Bowl game, I think, my God, he doesn't need a stress test. This is his stress test, and I should probably just put a heart monitor on him. So it's not only physical. We see other things. You will have patients come in and say, I think I need an MRI. This is the classic one I get. I need an MRI. I'm sure something's growing in my brain. I have a tumor. I have something like that because I can't think clearly. I can't sleep. I can't relax. I'm angry. I'm on the edge. Right? Many people know what it's like to be on the edge, and then, your poor kid comes in and asks a question and you snap, or your assistant comes in and says, have one more patient you have to see, and you just about lose it. And I think we all have to be real that almost every one of us have been in this position. So these are just some of the warning signs. Anger. Anger is probably the most lethal emotion for the heart. And think about the metaphors we use around anger. We say he's a hothead, her blood is boiling. So think about that in light of what we just said: high blood pressure, high heart rate, platelets are sticky, vessels are constricting. This is a setup for cardiovascular events. This study was in the Journal of Circulation many years ago, but oh my goodness, worth discussing. They looked at 1,600 people coming into the emergency room, and what were you doing 2 hours before your heart attack? And they concluded that anger increases the risk of an MI by 230%. So when we're talking about red yeast rice and statin therapy and a good diet, we really need to be looking at what's going on in our patient's life. These are some of the typical questions in an anger questionnaire. I'm a hot-headed person. I fly off the handle. In Ayurvedic medicine, we call these people, fire, pitta personalities. And when pitta is unbalanced, it comes up as anger, it comes up with fire and heartburn. And from the Ayurvedic perspective, totally fascinating. I get angry, I say nasty things, I get frustrated, I feel like hitting someone. I can remember being in the ICU when a colleague, a cardiologist, decided to punch a metal file cabinet and was then escorted out by security because the nurses were so frightened. And he had just reached his breaking point. It was just too much. He's a great doctor. He just hit his edge. So those people with the highest level of anger, when you look at the cardiovascular literature, have the least probability of survival. Anger is a bad player. Anger causes arrhythmia. This study looked at, now that we have people with ICDs, defibrillators, we can monitor these things. And what we see is that anger can trigger ventricular arrhythmias in patients. And it's very easy now to follow with some of the technology we have. Anger has been linked to episodes of atrial fibrillation. When you think about it, it's adrenaline outpouring into the body, and it's causing coronary constriction. It's increasing the heart rate. All of these things can lead to arrhythmia, and it doesn't have to be a fib. It can be APCs and VPCs. Now, some very interesting research has come out about telomerase and telomeres. Now, telomeres are those little caps on the chromosomes, and telomerase is the enzyme that is linked to telomere formation. And now we can understand through the language of science, we're starting to use technology and use science in a way that we could never do before to understand the impact of stress on telomeres and telomerase enzyme. So one of the key people to study this is the Nobel Prize winning Dr. Elizabeth Blackburn. And what she said, that this is a conclusion, and we'll come back to some of her other studies. Maternal psychological stress during pregnancy may exert a programming effect on the developing telomere biology system that is already apparent at birth, as reflected by the setting of newborn leukocyte telomere length. What is she saying? The telomeres of babies who come from women who in utero had a lot of stress are even shorter in young adulthood as compared to mothers who did not have the same stressful situations. So children can come in imprinted. And even if they do, this can be transformed. What about racial discrimination? These boxes here are showing high racial discrimination leading to low telomere length. And that's something I don't think most of us have ever thought about. So shorter telomere length leads to increased risk of cancer and overall mortality. Cancer incidence rates are 22.5 per 1,000 person years in the shortest telomere group versus 14.2 in the middle group and 5.1 in the longest telomere group. Shorter telomeres, you can think about this, can lead to instability of the chromosome and result in cancer formation. So now we understand, again, through the language of science, the impact of stress on the telomerase enzyme and the telomere length. I thought this was a very brilliant study. Again, Elizabeth Blackburn, 58 premenopausal women who were caregivers of their chronically ill children versus women who had healthy children. The women were asked how they perceive stress in their lives. And does the stress in their life impact their health by affecting their cellular aging? That was the question of the study. So they looked at telomere length and telomerase enzyme. And this is what they found. Now, the key word here is perceived. We are not to judge each other's stress. Stress is personal. Our response is personal. And some of our response may be genetic. For example, someone who has a COMT, homozygous COMT with a sluggish gene may have a lot more anxiety than someone who doesn't have this genetic polymorphism. Someone who has an MAOA and an MAOB may have more anxiety than someone who doesn't have that genetic polymorphism. So there is a genetic component to our response. But what she found was perceived psychological stress and the number of years caring for chronically ill children was associated with shorter telomere length and less telomerase activity, providing the first indication that stress can have an impact on telomere maintenance and longevity. That's powerful. And all of us in healthcare are under some form of stress. And the question is, what can we do to transform our response? Framingham also looked at something else. Framingham looked at depression and identified clinical depression as a bigger risk for cardiovascular events and poor outcome than smoking, diabetes, high LDL, low HDL, which is kind of crazy because we spend all of our time on these things, and yet we really don't spend a lot of time dealing with the emotional aspects of vascular disease. This is a Beck depression inventory, which is a simple screening test for depression, looking at people who had high levels of depression versus low levels of depression. And what you can see is as you go from low levels to the highest level, as you work your way through, the chance of survival becomes less. And many of us have our theories as to why this occurs. And is it because if we're depressed, we don't say, oh, I'm going to eat Schilper's Brussels sprouts, and I'm going to take those B vitamins, and I'm going to go out and exercise, and I'm going to do Dr. G's meditation? Or are we more likely to say, I have 20 friends in this pack of cigarettes, and these Cinnabons are tasting pretty good right now, right? So depression is a big player. 75% of post-MI deaths are related to depression, right? So looking at patients, now you have to ask the question here. Is it the depression that's causing the problem, or is it the cytokine sickness that's already led to the heart disease causing the depression? And I think we have to factor all of this in. So post-MI, independent risk factor for an event is depression. And yet another study looked at over 4,000 people with no coronary disease at baseline. For every increase of 5 points on the depression scale, that increased risk 15%. And those with the highest depression scores had a 40% higher coronary artery disease rate and a 60% higher death rate. So I used to think it was all about eating the Cinnabons and the cigarettes. It's like, what came first, the chicken or the egg? But I really think it's a cytokine sickness too that leads to the MI, that leads to the vascular disease, leads to the depression. And then, of course, when you have an event and you come out, that has a whole host of issues around it. We know that people who are depressed, twofold increase in mortality, fivefold increase in death after a heart attack, poor outcomes with surgery. Every surgeon knows this. They don't want to do surgery on depressed people. They know the outcome is not good. And of course, less likely to follow through on all of our great functional medicine recommendations. So what are some of the mechanisms? Autonomic dysfunction has been evaluated, heart rate variability, low levels of omega-3s, which have a profound effect on the brain, low levels of vitamin D. There's those inflammatory cytokines we talked about, not getting restorative sleep. And many of our heart patients do have apnea. And remember, don't just think it's the heavy set heart patients with a thick, short neck. It can be quite deceiving, and it's really important to look at the structure of the face. And of course, social connection, which I think is the secret sauce. So is autonomic dysfunction a mechanism? One study looked at heart rate variability in people with a recent MI, and they looked at over 300 people with depression and those without depression, and they found that there were 4 indices of heart rate variability that were lower in people with depression. So here's 2 groups of people having a heart attack and heart rate variability rising to the top as a possible etiology. I like this one. I think the gut is everything. And for me, my heart patients laugh because they say, you're the cardiologist. Why do you care about my microbiome? Why are you worried about my short chain fatty acids? Because all that gut inflammation is causing cytokine sickness. And what a lot of us have forgotten since medical school is that many of our neurotransmitters come from the gut. So chronic inflammation and exposure to inflammatory cytokines appears to lead to alterations in dopamine function and the basal ganglia, reflected by depression, fatigue, and psychomotor slowing. So I can't emphasize enough the role of inflammation and depression. If we take a look at acute coronary syndrome and depression, that was associated with higher markers for inflammation, higher CRPs, lower lower heart rate variability, and something that never gets checked in the hospital, which is nutrition deficiencies. And in this case, they looked at omega-3s and vitamin D levels. So at a minimum, an omega-3 check and a vitamin D level deficiencies. And in this case, they looked at omega-3s and vitamin D levels. So at a minimum, an omega-3 check and a vitamin D level is warranted in all of our patients. And certainly if you can get a full you have osteoporosis, you have loss of muscle, you have immune dysfunction, you have fat around the midline, you have high blood sugar, everything we associate with aging. My skin is sagging, my belly is big, my bones are brittle. Every single thing comes from elevated cortisol. And by the way, I really think this is why our yoga instructors, my yoga instructor looks 20 years younger than she is, and she lives a yogic life. And she's not exhibiting these classic signs of aging. High cortisol, heart disease risk 2 times higher in people taking high doses of steroids. Small amounts of steroids don't seem to have the same risk. Low doses, not as big a deal. Of course, we try to get our patients off of steroids, but the point here being that cortisol is a stress hormone, and it's a stress hormone that raises blood pressure and puts weight on the midline, makes us diabetic, causes insulin resistance, and the list is endless. So cortisol is a big player. And I mentioned a couple of the functional tests that I do in the previous talk. I said I like to do a food sensitivity and a 3-day stool and a NutriVal. I really like to do an adrenal stress index salivary test so I can get a 24-hour cortisol and take a look at what's going on with my patients. With a foot on the gas pedal and a heightened sympathetic nervous system and high cortisol, all the things we talked about, from coagulopathy to decreased heart rate variability to central obesity to diabetes, and of course hypertension and turning on the renin-angiotensin system, it's all linked to stress. Let's take a look at life. This is a study that looked at 126 Harvard medical students, and they were followed for 35 years. long study. And they said, what's the incidence of significant illness, heart disease, cancer, hypertension? And they asked these students, very simple question. What was your relationship with your mom and with your dad? Was it very close? Was it warm and friendly? Was it tolerant? Was it strained and cold? This is what they found. They found that if the students identified their relationship with their parents as strained, 100% incidence of significant health risk 35 years later. If they said it was warm and close, that number was cut in half. And you might want to think about what is it that, what could explain this? And you'll see in a few minutes how adverse childhood experiences make us sick, how we learn our coping skills from our parents. Our parents are the ones who frequently teach us how to get angry or how to resolve conflict. Our spiritual tradition comes from our parents frequently. So our parents have had a profound effect on us. And when you think about that, our connection as well, this is not very surprising. This is a 35-year follow-up study. This was Linda Russick and Gary Russick. This could be my family. Maybe they did take a photo. This is our Italians. And I love the Roseto study. You know, Roseto is a small town in Pennsylvania. And many of these families migrated from Italy to Roseto. And for some reason, the people in Roseto were not having heart attacks, yet they were smoking cigarettes and they were diabetic. And, you know, they had all the classic risk factors. But unlike the surrounding towns, Roseto seemed to be spared from their cardiovascular disease. And what the researchers found was what was holding Roseto together was the community of Roseto, 3 generational households. Here's a perfect example. Parents, child, grandparents, all living together. High degree of religiosity, spiritual traditions, traditional values. They could not find anything else different about this group of people. It's not like saying this was the blue zone community of Loma Linda where everyone was vegan and taking a Sabbath and walking and all these great things we know about the Seventh-day Adventist community. These were my Italians who were just eating and drinking and living their life, and yet they weren't having heart attacks. What they found after the 1970s was that these multi-generational households begin to break up, kids moved away, people became more mobile, and the incidence of heart disease and cardiovascular events and mortality became the same as surrounding communities. And the Roseto effect, the protection was gone. So I think connection is everything. And I don't know how parents honestly do it who have maybe elderly in-laws and parents living 3 miles or 3,000 miles away, and they're raising children and homeschooling children. And but to come home and maybe have a grandparent. I was fortunate to have a grandma in the kitchen cooking all the time. And I would sit there and do my homework at the kitchen table. Not just to not be home alone, not to mention getting home cooked meals, which are part of the Mediterranean diet program. So love is everything. And, you know, at the Academy of Integrative Medicine, we say love is the greatest healer. And I really believe that, because I believe that when we are with our patients, we can be giving them the greatest of science and the best information, but we really need to deliver it with intention and with love. What about marriage? People who rate their marriage scores as high, much less cardiovascular events than those who describe their marriage scores as low. However, I will say that the research shows that men who are married, even if the marriage is not perfect, men do better when they're married. And of course, I'm going to say because women take care of them. What about adverse childhood events, or what we call adverse childhood experiences? This is the work of Dr. Vince Folletti right here in San Diego, who looked at adverse childhood experiences and disease in midlife. And what he found, his ACE research is another one of those must-read research studies. And there's tons of spin-offs from this, but he found that the more trauma a child faces, fighting, hitting among parents, hitting children, parents in jail, sexual abuse, the higher the risk of major illness, as well as drug and alcohol, as well as IV drug abuse. You can think about this. I mean, how does one comfort themselves when their world is falling apart around them? So looking at someone's life, we talk about toxic environments and we think of, lead, mercury, and cadmium. But there's another form of toxic environment, and that's the environment in which one lives. And it has a profound effect, particularly on addictions. So these are the top 10 US addictions. Alcohol, number one, which people seem to sort of just go with the punches. Hey, my wife and I have a bottle of wine every night. And everybody's like, oh yeah, I get that. Well, that's a toxin. Smoking cigarettes, drugs, gambling, overeating. Now we have video games, and we have full programs for people with video game addiction, internet addiction, sex addiction, shopping addiction, which all those, those online and those television shopping networks just love that one. And of course, we have work addiction, and I'm sure some of us could be accused of that. So these are the top 10 US addictions. So how do we transform our response to stress and tension? How do we start to build a program into our lives and help our patients build something into their lives? And it really starts with who you are and what resonates with you and your belief system. I encourage my patients to get out and walk. While everyone has been having quarantine panic, I said, go outside, go out and breathe the fresh air. Let's get out and be in nature. Other approaches may include guided imagery, learning meditation, biofeedback, prayer. I have my patients journal. I have them write down the things they're grateful for. I have them practice their forgiveness work. I have them let go of all these assumptions that they make about people and things when they don't really have all the data. Oh, she did this to me because, well, you don't know that because you haven't asked that question. Get rid of the caffeine, especially for people who have panic, anxiety, short fuses. Learn how to practice effective communication. Look at your support circle. Where do you get your love and your social support? And of course, there are some nutraceuticals to help us along the way. But I invite everyone to say, okay, I'm going to exercise every day. That's what I do with my patients. And then they have to make a decision about what's going to be their body-mind approach, what works for them. And we almost always can find a path. There are a few nutraceuticals worth mentioning. The first is SAMe, S-adenosyl methionine. This is part of the methionine homocysteine cycle. Over 80 clinical trials, 40,000 people. Basically, the bottom line is this: comparable or more effective than antidepressants. When someone comes to me and they have a joint pain or inflammation in their joints and they're depressed, SAMe is one of my go-to nutraceuticals. Very well tolerated. The only time I don't give SAMe is if someone has a history of mania or bipolar, because it can make things worse. This is a study where SAMe 800 milligrams twice a day was added to an SSRI, resulting in enhancement of remission rates, 25 versus 11% for placebo. So it's a nice, like folate, it can be a nice add-on if someone is on an antidepressant. It doesn't cost a lot of money, and I recommend starting at a low dose. I usually will start 400 milligrams or 200 milligrams in the morning and midday, because some people can wake up from SAMe, and then if needed, I'll take it up slowly. Important to give it on an empty stomach. So I love SAMe, especially for depression and for people who may have, and almost all our patients do, some sort of inflammation. St. John's wort is a great one, few side effects. You really can't OD on St. John's wort. Takes about 3 weeks, like an antidepressant, to kick in. 29 studies, over 5,000 patients. What they found, it is superior to a placebo in treating patients with major depression, but similarly effective as antidepressants and has fewer side effects. So, SAMe got a bad rap. They said, oh, it's no better than placebo. Well, if it works, I'll take the placebo. And certainly for mild to moderate depression, if it's as good as a medication, I might opt for that. But you'll see the caution in a minute. This study was looking at looking at St. John's wort versus placebo. It was an 8-week randomized controlled trial. Patients with mild and moderate depression with significant reductions in their depression score. PHQ-9 significantly improved using St. John's wort. This is the downside. St. John's wort can interfere with almost every prescription drug, but if you have someone who's not on any prescription medications, this is a great choice. And you have to take a look at how you're going to dose it. Try to find a product that's of good quality with 0.3% hypericins. That's a general way to go. Usually 2-time-a-day dosing, up to 900 milligrams a day. For mild to even up to major depression, it's a good choice, but remember, interacts with a lot of drugs. Vitamin D, we talked about those heart patients with depression have low levels of vitamin D. The brain has vitamin D receptors. Low levels of vitamin D and high parathyroid hormone associated with higher levels of depression. And of course, this in fibromyalgia as well. Psychiatric patients in general, across the board, tend to have lower levels of vitamin D. So vitamin D is not really a vitamin, it's a hormone, and certainly one we should measure and replete. This is, especially this time of year, a nice, easy treatment for depression. We always talk about seasonal affective disorder as being treated with a light box, but you can use this for any form of depression. And it is as good as taking 20 milligrams of fluoxetine, has no side effects unless someone has eye issues, and they can talk to their ophthalmologist about that. But this is really quite safe. 10,000 lux, 30 to 60 minutes in the early morning is a great way to go without taking a pill for treating depression. So there are so many things that we can do. One of the things that I like to do in my clinical practice is to look at some epigenetics around neurotransmitters. I don't look at everything, but I do look at COMT, I do look at MAOA, I look at MAOB, I look at MTHFR, I look at MTR, MTRR, and I look at CBS, as well as, of course, nitric oxide synthase. And that helps me to at least understand what's going on from a genetic perspective on my patients. If I ever need to give someone a medication, I do a pharmacogenomic test. I do that specifically looks at all the antidepressants, all the antipsychotics, all the anti-anxiety agents. I want to look at someone's genome with these medications. But for those of us who just want a couple of nice supplements, SAMe, St. John's wort, if someone particularly with MTHFR and a normal count, B vitamins should definitely be added, especially activated forms of folate, omega-3, getting out and exercising, critically important, and of course, doing some of the inner work that very frequently needs to happen. Light therapy is a easy way to go, and checking the obvious, looking for thyroid, especially hypothyroidism for depression, looking at vitamin D levels, doing your omega check, and so on. So these are just some simple things we can do in our practice. So a wonderful spiritual teacher, Aja Shanti, said, suffering happens between the ears. Everything else is just a situation. And Mark Twain said, I have suffered a great many misfortunes, most of which never happened. So I think how we respond, our perception, our response, what's going on in our mind is critically important. The worries of the world worry about things that never happen.
This is an awareness test.
Have some fun with this.
How many passes does the team in white make?
Go!
The answer is 13. But did you see the moonwalking bear?
Go!
So it's easy to miss something when we're not looking for it. And very frequently we end up with our tunnel vision. I love this quote from Eric Butterworth. He says, you see things not as they are, but as you are. Your perception is shaped according to your previous experiences, your faith, and according to where you are in consciousness. More important than changing the things out there is changing the way you see them. And you know, if you miss the bear, sometimes maybe when we get focused on just one thing, we could miss the big picture. So our perception is everything, and two people can have the same exact experience and have totally different responses. One gal screaming and the other gal laughing, totally different reaction to the same thing. We talked about heart rate variability, and it's important to note that a low heart rate variability increases the risk of heart attack and sudden death. But what's really wonderful to know is that heart rate variability, which is a predictor of mortality in old age, can actually be changed. The research shows that repetitive prayer and mantra repetition can change heart rate variability pattern. Mantra is a sacred word. It could be a chant or a sound. The repetition of a mantra is really to cultivate inner peace. It can be something simple like Shalom or Rama. Well, a mantra literally means to free the mind. Many of us have monkey mind where we jump from thought to thought to thought. So I invite you to pick a sacred word that allows you to come back to, it's like coming back to the breath in mindfulness practice. You come back to the word and your body goes into a state of relaxation. The research shows decreased sympathetic tone, and improved heart rate variability. Here are some mantras that we used on the Vietnam vets in Jill Borman's work. The Buddhist mantra, Om Mani Padme Om, for example, Hail Mary. Honestly, it doesn't matter the spiritual tradition. These are just some samples. But what she found is that repetition of the mantra reduces symptoms of stress and anxiety. As a matter of fact, mantra repetition in Vietnam vets with PTSD, 90 minutes a day, reduction in stress, anxiety, anger, improvement in quality of life, and spiritual well-being. Look at the p-values here on perceived stress and anxiety. This is powerful medicine. How do we break the cycle of monkey brain? And mantra is one way to do it. Another study looked at healthcare workers. This is much needed right now. Found that mantra repetition, repeating a spiritual word, improves anxiety, stress, anger, quality of life, and spiritual well-being. Again, really nice p-values on some of this research. Small study, but valuable for medicine and easy to teach. In the early days, the Maharishi group, Transcendental Meditation, did a lot of studies and published in American Journal of Hypertension, looking at blood pressure, showing small reductions in blood pressure with TM, showing improvements in anxiety with TM. But not too long ago, an amazing study came out looking at, with a 4.5-year follow-up, African Americans with severe hypertension doing transcendental meditation twice a day. And even though the numbers in blood pressure reduction are not huge, right? 4.9 millimeters of mercury, that wasn't the issue. What was huge in this study was a 48% risk reduction in the primary endpoint of heart attack, stroke, and sudden death with transcendental meditation. And I will say more important than just the blood pressure and reduction in anger is improvement in inflammation and heart rate variability. So meditation is powerful medicine. Mindfulness-based stress reduction also studied, showing increases in telomerase activity. So you don't have to just say, well, my telomeres are low because telomerase is low because I'm under stress. No, you can do something to transform that response. We know that an 8-week mindfulness program results in more positive affect, and this has been studied, improvement in response to vaccinations with the influenza vaccine, with significant improvement in antibody titers, and I think the latest and greatest research showing improvement in telomerase enzyme. Meditation, this is mindfulness-based stress reduction, looking at anxiety, pre-treatment and post-treatment with significant reductions in anxiety. And, you know, when I started practicing in 1995 down here, we had one study on meditation. And now when you go to PubMed, it is just filled with great research. So the times, they are definitely changing. JAMA had this to say: meditation, improvement in anxiety, depression, pain, and quality of life. I never thought I would see that coming out of JAMA in 1995. So let's talk for a few minutes before we go on social support. Satchidananda is another wonderful spiritual teacher, and I just love this quote. He said, "The I in illness is isolation, and the W in wellness is we." And I think this is so true. Well, what happens if we take an animal and we put them in a stressful situation? I don't like doing things like this. But what they found was that the same stressor when given to an animal who is alone, increases plasma cortisol by 50%. That same stressor does not increase the cortisol if the animal has a familiar companion with them. And these two guys, or three guys, are definitely not stressed. So just being with someone that you feel close to can make a difference in your stress response. 276 volunteers decided to have the rhinovirus placed in their nose. Some people got sick and some people didn't. What did the study show? Those who had the least number of positive relationships developed cold symptoms 4 times more frequently. Again, the power of social connection. I think if we used all of our seniors to take care of our kids in after-school programs, it would be one of the greatest things we can do in our country. A study of 700 older adults showed those who gave love and support to others had much fewer health concerns and health issues. So it is better to give than receive. I think being home alone is a really bad thing. I like going back to the old melanoma research where people who had removal of melanoma from their skin were asked if they would participate in a support group. The same studies were done with breast cancer. And the thought was always, oh, these people have a bad thing. Let's put them in a support group so they're sort of not alone. But what the outcomes, both for breast cancer and melanoma, shocked everyone. 5 years later, the control group had 13 recurrences and 10 deaths versus 3 deaths in the intervention group. Again, the W-E in wellness is we. So Florence Nightingale, the mother of nursing, said, "The needs of the spirit are as crucial to health as those individual organs which make up the body." Mayo Clinic research shows us 90% of people believe in a higher being, 94% regard their spiritual and physical health as equally important, and 96% of family practice physicians believe that spiritual well-being is a factor in health. Research from Mayo Clinic shows that people with a strong spiritual or religious background tend to have lower blood pressures, be more compliant with medication, exercise more readily, will give up cigarettes and alcohol. And I think when we look at the Seventh-day Adventist community, this is one of the few blue zones, if not only blue zone in the United States. And that community is, of course, wrapped around a religious belief system. The research shows that people who are spiritual or religious are more accepting of death, less anxiety and depression, less likely to need addictive things like alcohol and drugs, and even less likely to commit suicide. So I really think the secret sauce here is turning things over to a higher power. And for many people, it's also accepting, surrendering, and recognizing that life has its ups and downs and gaining strength from one's belief system. Lack of participation in community groups, again, the we, and decreased strength and comfort from religion are independent risk factors for death following cardiovascular surgery. Again, are we home alone? Loneliness has been shown to be as bad as smoking 15 cigarettes a day, being addicted to alcohol, not exercising, being obese. People who are lonely do worse than all of those classic cardiac risk factors. So what's the secret ingredient? I think the secret ingredient is strong social support, increased hope, love, contentment, optimism, a belief in the divine plan, feeling that things are based on your belief system, are going to be okay, I think all of these things are associated with lower catecholamines and lower levels of cortisol. So at the end of the day, I think we have to ask ourselves, who are we and how do we respond to stress in our life? Who shows up? One of my friends had a mom who used to say, stress is like a tea bag. And I would say, how so? She said, you don't know what you get until you put it in hot water. And I thought, wow, that's really true. How do we respond and transform our stress response? So when you're in traffic, you have two choices. Is this great traffic or what? Or you can get angry, honk your horn, and make yourself sick by flooding your body with stress hormones. So I'd like you to think about how you are cultivating resiliency. What is your strength in the storm? Because we really want to know, and we want to share and learn from each other. So for me, it's about doing meditation and chanting, at least once a day of meditation and chanting, and earlier in the morning, just meditation. It's walking in nature. It's walking my dog. It's getting on my Peloton, burning off that extra energy. But I can tell you that my spiritual practice and my transcendental meditation practice have really been, for me, anchors that have kept me grounded. So thank you. And I really appreciate you being here, especially for those on the East Coast at a very late hour.